Good morning, everyone. My name is Chandler Villa, and I'm with Yvonne Wyatt Rose, and
Hello.
as my editor. And then we have Desiree Martinez as our member. And we are with MHMR Substance Abuse Center, and we're going to present to you on our research findings. We are all Tarleton BSW students, and I'm going to go ahead and get started. Alrighty, like I said, we're with MHMR, Substance Abuse Center, and we're going to talk to you about the lack of access to substance abuse treatment in rural areas. And this was our project and research over our 4 semesters with Tarleton. We are all currently seniors and finishing up on our macro project. To kick us off, I'm going to hand it off to Yvonne to tell you a little bit about our services with MHMR.
As Chandler stated, we are with the MHMR, the Heart of Texas Mental Health and Mental Retardation Substance Abuse Services Program. This service, our agency provides same-day access and service to substance abuse treatment for adults as well as adolescents, and we coordinate services with community partners to ensure that there's a holistic approach to treatment and health overall being attained.
I'm going to go back to me and tell you a little bit about our problem statements and objectives identified for our research. So for our problem statement, we stated the student researchers would focus on the lack of access to substance abuse treatment in rural areas. That led us to have 4 different objectives, which were to identify the use of telehealth services in rural areas for substance abuse treatment, to examine how telehealth affects clients utilizing substance abuse treatment, to understand how telehealth services could benefit the rural populations with substance abuse, and finally, to inspect barriers the population in rural areas may have when obtaining substance abuse treatment. Now I'm going to pass it on to Desiree to tell you about one of the theories we used for our research.
Yes, so our first theory that we came up with was social learning theory, and this explains the connections between individuals and their emotions, behaviors, and attitudes, and then their reactions to others through that observational learning. Albert Bandura was actually the founder of social learning theory in the 1960s. Bandura pursued his study in the theory to observe those developmental theories and observational learning as a detriment behavior change in individuals. The social learning theory is relevant to the us because the theory can be applied to individuals surrounded by addictive behaviors within those rural areas.
Now we're going to talk about the 3 themes we were able to identify for our research. So for the first theme, we identified substance abuse treatment. This is where we went and researched 4 peer-reviewed scholarly articles, and these each provided a different research method or design to collect the data, but each case had similar results to the effectiveness of substance abuse treatment.
For theme 2, we selected rural substance abuse in parallel to just looking at urban. We identified rural. There were 4 articles that we selected for that. Each of these analyzing the disadvantage that rural areas, in contrast to urban areas, may encounter and the burden those individuals may have to face when looking for substance abuse treatment.
And then our last theme are benefits of telehealth. And we found 4 articles related to the benefits of telehealth. Each of these articles share similarities of a case study or statistical information resulting in the benefits of using telehealth services for substance abuse treatment and mental health in rural areas.
This went ahead and helped us identify a research question that we'd be structuring our survey and rest of our research about. So we stated, how can telehealth be useful in rural areas for substance abuse treatment? This question was developed with working closely with our community partner, Jamie Schmidt, to develop a problem analysis where substance abuse treatment in rural areas was identified as a common problem within the agency services. I'm now going to pass it on to Yvonne to discuss a little bit about our method and design of the research.
The actual instrument that we designed was a survey to be able to conduct this. And we started out by identifying we wanted to do an explanatory study. The sample was 137 participants. We used probability sampling method. We selected this because it was the use of simple random sampling. It allowed us to randomly sample, approach individuals or participants, allowing a diversity of information to be collected that was able to be compared between rural and urban residents. It was a quantitative study, and this data was analyzed so we can look at the demographics, the residential types, the knowledge of substance abuse treatment in rural areas, and also the knowledge of services for substance abuse treatment.
A little bit about our survey. So we had 16 questions. 5 of those questions were demographic. So from age, gender, race, county of the resident, and then rural residency. 3 of them were multiple response questions in relation to commonly used drugs, available treatment services within the participant's area, and then accessible technology. 6 questions included 3 yes or no questions, and those regarded substance abuse issues and telehealth usage. 2 were a Likert scale questions regarding telehealth services, and then we had 1 question regarding distance to accessible treatment. And now we'll go a little bit into some of the results that we had from the survey. So on the demographics, as you can see, the gender, majority of them were female. We had male and then 1 non-binary. And then for the age, you can see it goes from 10 to 20, 21 to 30, 31 to 40, 40 to 50, and then 51 or more years older. And then just a little bit continuing, we have a breakdown of individuals in their county and where they live. And it goes from Bosque, Falls County, Freestone, Hill, Limestone, McLennan, Bell, and then Dallas was one of them as well. And then we also have a breakdown of race. And as you can see at the bottom, it says there's African American, Asian American, European American, Hispanic, Latino, and then a mixed race. And then the residency of rural areas. So this is a pie chart, and 1 equaling yes, they live in a rural area, and 2, they do not live in a rural area. And as you can see, the 2 were the majority, so there were not many who took the survey who lived in rural areas. And then as for the distance travel, we also used a pie chart, and we used a scale for them to check off. So it was less than 5 miles, 2 being 6 to 10, 3 being 11 to 15, and then 4 being 16 to 20 miles, and then 5, 20 or more miles.
We'd like to note that about 25% of our participants, even though most of them had replied that they were living in urban areas, had to travel at least 20 or more miles to receive services. This now then took us into our hypothesis testings. We had hypothesis 1, which was participants will report the availability of telehealth services in rural areas to treat substance abuse makes treatment more accessible. This is where we ran a chi-squared test, and our results were to accept the hypothesis and reject the null. I apologize, which is meaning that the P was 0.000, which was statistically significant. The results did show that actually 46 actual rural residents that participated, 24 reported travel to treatment would take at least 20 or more miles.
For hypothesis 2, we identified that participants would indicate that telehealth services specifically in rural areas to treat substance abuse would be useful and more useful than current available services. For this, we tested this with a cross-tabulation. The results, however, yielded no statistical significance, so we had to reject our hypothesis and accept the null.
As for the third hypothesis, so the participants with substance abuse issues in rural areas are more likely to seek telehealth services, and the test ran for this was the cross tabulations. And the results showed no statistical significance. However, the results did show the participants located within those rural areas were likely to use telehealth services. So we did have to reject this hypothesis. And then going into our strengths and limitations, so we did identify 2 areas of strengths for this study, which were, or 3, diversity in participants, the focus is on a unique population, and then we listed COVID-19 as a strength and a limitation. I feel like the COVID-19 was more a strength because it gave us results
Relating to telehealth.
related to telehealth, sorry, yes.
Okay.
And then the limitations to our research were the inability to survey actual MHMR participants. As you are aware, substance abuse clients are a protected class. So due to their confidentiality, we were not allowed to actually survey the participants. And so this was a skew in our data, along with the fact that we were limited to any in-depth questions to be able to get some qualitative answers to actually hear from the actual participants. And then COVID-19, as Desiree said, ended up being a strength and limitation because when we initially identified our research question and problem, COVID-19 had not came into play. So therefore, we were not recreating or reinventing a wheel. We were just attempting to retread it so it could become all terrain. But because COVID came in, it actually allowed everyone to have to get some type of digital or technology to be able to be accessible to everything, just daily survival. So again, COVID-19 became a strength as well as a limitation to our research.
Now we're going to talk about how our research could be used on different levels of social work research. So on a micro level, this will continue to meet individual and group needs in rural areas by addressing the barrier of accessibility for treatment for needed services. It will also assess the benefit of current telehealth usage, and finally helping with the agency understand the primary substance of being abused within the rural areas to enhance the informed practice, knowledge, and treatment.
On the meso level, the implications for future social work research are that this allows collaboration with schools, hospitals, any other community entities. You could partner together with them and stakeholders to address adolescent substance abuse usage and provide some really good treatment there. It also creates an opportunity to expand partnerships with substance abuse treatment facilities so that you can meet or create a more holistic approach when you're doing treatment, as well as it increases community awareness to allow individuals that reside within the community as a whole to just know that service treatment is available and you can educate them to actually create more support.
For the macro level, it compares the substance abuse treatment agencies within Texas that also serve clients who reside in those rural areas. Comparison could aid in determining certain policies, funding, staffing that may be implemented to provide a more effective and successful treatment program within those areas as well.
We'd like to wrap it up and just tell everybody thank you so much for coming and listening to us. If you have any other questions, we put our emails at the bottom, and we also want to take the time to give a special thank you to our community partner, Jamie Schmidt, and to our professor, Dr. Lang, for all the support and keeping us going, really. And I want to take the time to thank my cohort and my whole team here that I have with Desiree and Yvonne, and the great work that we've done so far and that I have no doubt that we'll continue to do. And I just wanted to thank everybody for coming and listening. And if you have any questions, please feel free to reach out to us and we get back to you. And finally, here's our references for all the work we just went over. Thank you again and have a great day.